So when I see patients during the day, probably half of them have not really accomplished the goals that they've set for themselves during the preceding year. If I can make an impact on those half, any impact whatsoever, because there's so many things they have to do. Dieting, exercise, medication compliance, sometimes smoking cessation. These are very difficult to do in total. So if I can accomplish one of them on that visit and move on to the next one, that's very satisfying. At the end of the day, if I can take, out of 20 patients, if I can get 5 or 10 of them to make significant changes, that's really rewarding. I have a patient who now is 86 years old, and I first met him in 1990 when he absolutely refused to have bypass surgery and told his cardiologist here at the university that it wasn't for him. I then had him as a patient since 1991, and now, this many years later, he still hasn't had bypass surgery. He works on his farm. He's very industrious. He's very happily married to a very supportive wife, and he had terrible disease when this all began. So he was a good example how exercise and nutritional changes, and they made major commitments, and behavioral changes. He was a very intense person. He had to learn how to relax, and he was very compliant with his medication. So every time I see HP, I really reinforce the idea that this works.